Well, it's a pleasure to be part of the eEzra webinar. I'll be discussing this topic: can we rely on social media to learn regional anesthesia and pain management? My name is Ed Mariano, and I'm a professor at Stanford University in California. I have no disclosures. And the first thing I should probably say is that there are various ways to learn regional anesthesia. I think that oftentimes we tend to think about our training as anesthesia residents and fellows, and then progressing on to being a practicing anesthetist. However, I think this is a more of a traditional route, and I think that the way that we train our residents in regional anesthesia has definitely evolved. And then the fellowship programs, at least in North America, really only date back until the 1980s, and it's only since in 2016 that we've actually had the opportunity to do fellowships that are nationally accredited, at least in the United States. However, the majority of our anesthesia colleagues who actually learn regional anesthesia will learn it out of training. And the reason I say that is because for many of us who practice medicine, our careers are about 30 years long or sometimes longer. And so for those who trained in anesthesia before some of the popular techniques using ultrasound were developed, many of whom include myself, we've had to learn regional anesthesia on our own. And so there has to be this track for the practicing anesthetist to learn regional anesthesia and then also keep up with the latest and greatest in new techniques and innovations. And so when I think about the literature, especially as it's evolved over time, we've seen really an explosion in fascial plane blocks. And we see this through publications, although we know that publications really underestimate clinical practice. If we do a PubMed search of plane block as the title phrase, we actually see a yield of about 400 or more articles per year for the last 4 years. And that's fairly, I would consider that a very, very large volume of new literature that has really changed the way that we practice regional anesthesia in clinical practice today. So when I think about social media, I think social media really represents a number of platforms, and not just one platform, but a number of communication tools that we use to network and also learn from our colleagues globally. And I've written an article for the Ezra newsletter about this topic that gives much more detail than I can possibly provide in 10 minutes. Of the number of platforms, at least when you look at survey data from the United States, YouTube is definitely the most popular, followed by Facebook. And then there's a bunch of platforms that kind of make up this middle, which include Instagram, LinkedIn, Twitter, as well as messaging programs, like WhatsApp. I think one of the roles for instructors in regional anesthesia today is really to acknowledge the fact that all of our learners, including ourselves, those who are in practice already, who are out of training, we're going to the internet for most of our information, just like our patients also go to the internet for information. And so rather than recreating a lot of these high quality resources, I think our job as instructors or teachers in regional anesthesia is actually to help our learners know where to go. And so, one of the important topics that I address with our fellows and residents is which sites can you use to actually get good information. And so I just gave one link. This is not the only one. There are a number of very good channels on YouTube that you can use for regional anesthesia, but this one comes from the Duke University Regional Anesthesia Group. And they have very good high quality videos that go through the evidence as well as technique for various types of regional anesthesia procedures. And these can be very good for just-in-time training, especially for anesthetists in practice who perhaps don't do regional anesthesia on a regular basis. There are other sources as well, and I think that this is really important to look at because ultrasound has really dominated the field of regional anesthesia. It's very amenable to video-based platforms. So TikTok is another one, and Melody Herman, an anesthesiologist in practice who runs her own TikTok channel, does a great job posting videos that can be very educational and very short in terms of the amount of video content and learning points. I tend to prefer using Twitter, LinkedIn, and Instagram. So they're, again, not the most popular platforms, but I like them because of their format as well as the brevity in terms of the amount of information. And then, of course, while technically not a social media platform in terms of networking, it is the use of podcasts is actually a great learning modality. And some of our colleagues, Amit Pawa and Jeff Gadsden, have developed this Block It Like It's Hot podcast that I now listen to fairly religiously every time they have a new episode. One of the issues with social media, and I think that this is very important, is that it doesn't automatically have content curation. So there's no validation of the scientific basis for what is posted on social media. And so it's very important for us as teachers and as practicing clinicians and researchers in regional anesthesia to be very wary and as far as what is posted on social media, and then still continue to look at some of these questions as investigative issues that we still have to look into further. A good example of this was the aerosol box that was very, very popular at the very, very beginning of the COVID-19 pandemic. And you can see from the bar graph that there were thousands of tweets per day that were referencing this aerosol box. And then, of course, we had studies that were published subsequently using simulation design that showed that the aerosol box actually did not decrease the risk of aerosol contamination. And so much of that hype tended to die out. And not to say that's the same thing, but I think that we have seen the effect of social media hype in regional anesthesia, and erector spinae plain block is one example. And not to say that that it's all hype, because we also recognize that this is a useful technique that has particular indications. But initially, there was a lot of social media activity on erector spinae plain block, and this really preceded much of the now what we call well-regarded level 1 evidence using randomized clinical trials and meta-analyses of erector spinae plain block. And so the hype developed by social media, definitely preceded the evidence for beneficial effect, and possibly led to a much larger indication or description of indications for ESP block. And now I think that our literature has finally caught up. And so I think that we have a much better understanding of when it probably is useful and when it probably is not useful. I think that what we really get from social media is a measure of public interest as well as attention. And so when you look at publications that are highly tweeted, using the Twitter platform as an example, we know that those are articles that very likely have some important topic or generate a lot of conversation. And that's probably important for us as practicing regional anesthesiologists and pain medicine clinicians to be aware of anyway. In addition, I think it's helpful for researchers if you know what's being talked about and what are controversial topics on social media. Those perhaps are important topics that you may want to pursue as far as research ideas for future studies. I think one of the important aspects of social media, in my opinion, is the ability to learn from conferences where you're not able to attend. And I think the reality, especially right now, with a global workforce shortage of anesthetists, is that we can't always go to every Congress. We can't always go to every scientific meeting. And so we're really going to have to rely on each other to teach each other what we're learning at conferences when we can attend. And so one of the important aspects of using social media, and in particular live tweeting from meetings, is that our colleagues are going to these meetings and they're sharing information that could be useful. Most of these tweets, when we've studied them, over 3/4 of these tweets are actually scientific in nature. So they can be high value, and they're coming directly from those conference halls that you're not attending, but they're getting information from the speakers that they can share with you. And I think as someone who uses social media to share information, I try to make my posts, my tweets matter. I want to make sure that they have good references and that they represent what the speaker's intent and message really was. And so if you have more information that you're interested in looking up as far as getting involved in social media, I'll reference this site. This is my own website that gives you a few pointers on how you can get started on social media. Thank you very much for having me.